Brazilian butt lift is a buttock augmentation and is a surgical procedure that is based on liposuction and fat injection. The basic concept is that by adding volume to the central and lateral compartments of the buttock, we can create an expansion of the whole anatomical area, and so a powerful lift. Liposuction can be performed in so many anatomical areas, including the lower face, the neck, the arms, the thighs, the knees, the calves, and certainly the anterior abdominal wall, the flanks, and the full back. The fat then needs to be purified from blood, from water, local anesthesia, and also from some oil that comes from damage to the fat cells before we can inject it in the areas where we want it to stay. I tend to inject an average of 600 to 900 cc's of fat on each butt side in order to achieve a more dramatic result, and the overall satisfaction rate is extremely high. It is very obvious how aging is associated with an increase of volume of fat over the abdominal wall and the flanks. At the same time, the fat in the buttock area tends to shrink and reduce in volume, so what we call the love handles become the most prominent part of our profile when we look at ourselves from the frontal view, from the side, but in particular from the back view. At the same time, the fat in the buttock area tends to shrink and reduce in volume, so what we call the love handles become the most prominent part of our profile when we look at ourselves from the frontal view, from the side, but in particular from the back view. This is where a successful Brazilian butt lift will recreate a much more youthful profile by reducing the abdominal circumference at 360 degrees, giving us a fuller and lifted buttock. This will become now the most prominent part of our profile, from the side view, in particular in the male population, or from the frontal and back views in the female population. The procedure can be performed under general anesthesia or under sedation. Most of the time is spent doing liposuction, and it's amazing how accurate this body sculpting can be when we select the appropriate technologies such as the Vaser and the power assisted. The overall time for surgeries can be anything between 1 hour and a half and 4 hours. And during this time, patients are rotated continuously on a surgical bed in order to understand exactly how the body is shaping by reducing the volume. This is extremely important also to optimize the level of symmetry and also to reduce the chances of irregularities that sometimes will show only when we look at the body from very specific angulations. Towards the end of the surgery, I might use the drains in order to reduce the incidence of seromas, and very rarely use sutures because the incisions are so small that they really tend to fade within 1 year or two. The cost for the surgery depends on a number of factors. First of all, how many areas a patient needs to have liposuction to, and how large are those areas, how much fat we need to extract from them. Certainly patients aiming for a mid or a high definition, for example, of the abdominal wall, will have a procedure that takes much longer than those that require instead a flat volume reduction. The addition of a Vaser technology certainly adds time and cost to the procedure. So the starting price in my clinic is £5,500, and the average cost of the procedure is £8,500. This includes all the hospital and anesthetic fees and follow-up appointments directly with myself for a lifetime. A careful assessment and surgical plan will reveal different types and severity of complications that will change from patient to patient. Certain complications are specific for liposuction, such as perforation of the abdominal cavity or the chest wall, seromas and tissue indurations, irregularities and asymmetry. Early management of swelling is critical in reducing the chances of complications and reduce also the risk of unfavorable results. So for this reason, in my clinic, we insist on three aspects. One is the use of excellent compression garments, the lymphatic drainage massage performed by well-trained professionals, and obviously early mobilization. These 3 points are so important that myself and all my team are constantly available to guide patients towards the whole healing process. The fat injection is associated with a completely different pattern of complications such as the lumps, cysts, fat embolism has also been reported, and certainly the fat can be reabsorbed partially. In order to recognize the complications at an early stage and treat them accordingly, it's very important to have a good collaboration between patient and doctor. So patients are invited to follow strictly the prescription and obviously the follow-up schedule. Patients are able to stand up, eat and drink straight after surgery, but I usually recommend to stay one night in a hospital in order to stay on the safe side. There is an agreed no sitting policy for 2 weeks, and during that time patients will have to sleep on their side or on their tummy. In absence of complications, I like to tell my patients that they will be back to their very full activity within 4 to 6 weeks.